In Paris, across the country, states have been seeing an increase in sexually transmitted diseases even before the pandemic began. According to the Centers for Disease Control and Prevention, cases of gonorrhea have increased 45% since 2016. Additionally, cases of syphilis have jumped 50% over the same time period, and congenital syphilis has seen an increase of 235%. Joining us now to go behind those numbers is Dr. Anu Hazra, an assistant professor of medicine at the University of Chicago. He's also part of the Chicago Center for HIV Elimination and a member of Mayor Lightfoot's task force to help prevent the spread of STDs. Dr. Hazra, thank you for joining us. First, what is your reaction to some of these numbers, seeing this increase over the last, 6-7 years?
Yeah, thank you for having me. Well, from the report that was just published this week, it's not very surprising. I think, again, like you mentioned, these increases are not new. It's not just related to the pandemic. These are steady increases we've seen across the board, across all bacterial sexually transmitted infections, now for nearly a decade, it's now reaching a sort of a 7-year all-time high. I think what it really invigorates a lot of us in the STI world is to really take action and really innovative action to help start to change the curve that we're seeing.
Now, we just cited some national numbers. How would you describe the state of STDs in Chicago and in Illinois?
I think those rises are pretty much parallel in the city of Chicago. I think the certain ones that are the most concerning, like congenital syphilis, while we are seeing rises, they're not as steep as what we're seeing in different parts of the country. And a lot of that has to do with investments that certain large cities do to public health, specifically in the realm of HIV and STI control. So by no means is Chicago perfect. There's still a ways to go, but in some ways in somewhat better shape than other parts of the country.
Now, we've said, it's not just because of the pandemic. You've been noticing this increase for the last 10 years or so. What is causing this increase in STDs?
Yeah, I think it's really multifactorial. I like to separate things by sort of individual level issues as well as structural level issues. I think on the individual level, as a whole, as a nation, we just don't really have great sex education, or more like not much empowerment around sex education. And that goes beyond just birds and the bees, but also just talking about how to take care of your sexual health on a more holistic level. And I think we have a lot of ways to evolve in that type of teaching from adolescence on, even onto young adulthood. I think at an individual level, folks have a hard time accessing sexual health care or understanding what sexual health care actually means. And then this kind of plays into the more structural level issues that go around in terms of lack of access to care in general, whether they be insurance or otherwise. And then really an overarching theme is just stigmatization that's around just the word sex, the act of sex, and then obviously any infections related to sex itself. I think, as a country, we have a lot to do in terms of dismantling that type of stigma around all STIs, HIV, and everything else.
Now, all of that said, what impact has the pandemic had on what we know about STI infections?
It's very interesting. So I think if you look closely at the CDC report, you see that that the numbers actually look like they decreased in the first 6 months of the year 2020. And that's really probably an artificial decrease, likely more related to the lack of testing than anything else. If COVID has taught us anything, we know that if we don't test for a disease, we don't see it. And so that's what we likely saw at the beginning of the pandemic. But however, what we see is by the end of the year, we matched, if not went above the cases that we've seen in years prior. So I think that's where the pandemic plays the largest role. I think what the pandemic has also done is really been a huge disruptor in the realm of how we deliver sexual health. Closing down a lot of STI clinics during this time, and we know people were still having sex during this time. And so it's not like STIs take a pause because of a pandemic. That still keeps going, and so our work continues.
How has congressional level funding changed over the last few years, and what impact has that had on those organizations that work to prevent the spread of STI?
I think there's been a lot of investments specifically around elimination of HIV as it sort of falls in line with the president's current End the HIV Epidemic initiative. And a lot of that funding comes directly from the federal level down to state and city levels and local governments to initiate certain initiatives to help decrease and really get to ending HIV in our country. And a lot of that ties hand in hand with STI control. The two don't live in silos. You have to work in concert with each other. HIV control is dependent on STI control and vice versa. So a lot of this funding that's coming from a national level that's earmarked for HIV, we're able to utilize for sexual health in general because the two are so closely linked as a syndemic.
And doctor, has there been or have you seen a disproportionate impact on either communities of color, folks who are low income, with regards to those higher rates of sexually transmitted infection?
Like all communicable diseases from COVID onwards, we see these fall along socioeconomic and racial fault lines throughout the country. And so it always has to come down to the haves and have-nots, who has access to care, who has access to education, who has access to resources, and who do not. And that, unfortunately, this country is, again, a structural issue based around sort of structural racism and gender inequality we have in this country. And so it is not surprising to see that African Americans, Latinx individuals, folks who identify as LGBTQ are disproportionately impacted by the rising rates of STIs in this country.
Now, you mentioned some innovative action around this prevention. I know in 2019, Mayor Lori Lightfoot created a task force to address the increase in STDs, which you serve on. Tell us about the work that group does.
Yeah, I think it's really important to realize that any work that we do has to be community informed. Any work we do in this realm can't come from ivory towers. We need to have feedback from what is important to community members and what will actually work on the ground. And so really the task force that we're a part of is a really great amalgamation of academic research experts, clinical experts, but then also community activists and organizers across the south and west sides of Chicago, which are the most disproportionately impacted zip codes, to figure out what are ways we can actually think about STI control amongst these vulnerable communities.
And before we let you go, what more could local healthcare providers, local governments be doing in the face of rising numbers, changes in congressional level funding?
I mean, I think as healthcare providers need to talk about sex in exam rooms. I think, just because your patients aren't talking about sex doesn't mean they're not having sex. I think this whole understanding, again, going back to trying to dismantle the stigma around sex and STIs, just normalizing sort of getting STI testing done, normalizing getting treated for STIs or whatnot, understanding that sex is part of the human experience. And if we're able to really acknowledge that, then everything else is much easier for us to manage. And then from the government standpoint, really thinking about, again, understanding that while we are prioritizing ending the HIV epidemic in this country, it has to be in concert with its STI control. The two cannot live apart from each other. They all play hand in hand.
Okay, a lot to think about, a lot of work to do. Dr. Anu Hazra, thank you so much for joining us.
Of course, thank you for having me.